This is Jerry Hesch. I'm a physical therapist, orthopedic manual physical therapist, which means that I treat joints and muscles and soft tissues of the body. Our client is kind enough to let us present his findings. And in standing, I noted a reduction of arch height in the right foot. And he's been walking with the right hip externally rotated. He did have tightness in the hip rotators, and we stretched them and taught him how to keep that mobility. But in standing, I'll demonstrate to you shortly how his arch is more flat on the right foot. And the question is, can we alter arch height with manual therapy? I looked at his eversion, so I'm trying to move the heel outward, okay? So I stabilize tibia and fibula, and then I pull the heel outward, and there is just so slight. Factory setting, okay? Factory setting is that he has very little eversion of the heel moving with the talus within the ankle joint. I could also squeeze the fibula and the tibia a little bit lower and block ankle motion, but again, there's not going to be much difference. Okay, so doing the same test here, it's very similar. Okay, very similar. But where I do find a difference is in rotation. Now, the first thing I'll test is abduction of the calcaneus, and then I'll overpressure it, and then I'll test abduction of the calcaneus. And visually, I'm having a, it's not the best angle to measure. I should be looking at it this way, but I don't visualize a difference. Where I do see a difference is when I adduct the heel. So I'm grabbing the calcaneus, the heel, and I'm twisting it outward such that the foot goes medially. Okay, that's called adduction of the calcaneus, and I'm allowing the talus to move with it. Okay, so then I can overpressure it. Okay, so that looks to be about 20 degrees. And when I do it on this side, there's a distinct reduction, and it's a hard end feel. Let me try and change my hand contact so that hopefully you can see that angle better. So this is adduction of the calcaneus moving with the talus. Okay, on the right, and then here is the same movement on the left, and it's much freer. Okay, let's look at him in standing now. So if you would come out here. And then step to the left just slightly. Very good. So I have this camera tripod to deal with. So I'm sliding my index finger from the back and pushing in with moderate pressure. And the deepest part of the arch goes here. Okay, so let me do that again, and you can see that line, okay, and I'm pushing medially with moderate pressure. Okay, now my two fingers, if we're going to be experimental, have similar height of the phalanx, so I'm going to use this finger. I'm using moderate pressure, and you'll notice it goes deeper. So see that small space there? And then see that larger space on this one. So he's got a deeper arch here. Okay? We've looked at rotation through the lower extremity through the femur. We've looked at rotation of the tibia. There's no restriction there. We've looked at midfoot motion. We've looked at cuboid motion, fifth ray motion. All of that is good, so we're not going to affect that. We might affect it by mobilizing the foot into abduction. Okay? So, yeah. Well, no. Let's have you go lie on your stomach. And scoot down a little bit more, please. Okay, so I'm going to distract the heel, the calcaneus, by pushing it downward like that. So I get a gapping of the joint. And that should make rotation freer. And then I'm going to oscillate it firmly, and I see that I'm gaining additional range easily. There's magic in distracting the calcaneus. And do you know that throughout a 24-hour day, there's no time in which this joint is distracted? It's always compressed. It's compressed in weight bearing. It's compressed when we walk, even though it undergoes movement, including eversion, inversion, abduction, and adduction. It's still compressed. When we lay on our stomach, it's compressed. When we lay on our back, our foot points downward, it's compressed. All right, so I lost track. I'll do 10 more. Okay, so we distracted it and then we adducted it. And I'm retesting eversion, and I do not notice any difference in eversion. Okay, let's go have you stand, please. Come over here and stand. And I'll certainly teach him weight-bearing supination exercises where he twists the leg outward and lifts the arch. So can you lift that arch up? Yeah, that's it. So good, do that a couple of times. Good. So now flat, good, lift that arch, good, repeatedly, and the leg rotates externally. Okay? So I'll have you do 100 of those every other day for about 6 weeks. Alrighty? So good, go ahead and relax. The line disappears. I'm definitely at least halfway through. See that difference? It looks like a 1/4 inch difference in arch height that we accomplished. So that's exciting. Why don't you walk down the hall and come back and let us know what you're aware of? This is probably going to be the only video on YouTube that shows this.
Oh, really?
I don't think there's any other video showing that the arch can be changed, can be raised by mobilizing the subtalar and partially mobilizing the talocrural joint. Subtalar is the joint below the ankle.
Before, doctor, like if I do like this, try and stand on my toes,
okay.
It pops a lot more.
It pops a lot more.
Now I feel a little difference. Like I feel a bit more stable, I think.
Okay.
Yeah, and maybe
all right.
like more strength, neural drive you call it, no? Like
nice.
Yeah,
nice.
in
yeah.
my ankle, yeah.
Yeah.
A bit, yes. But I still feel off, doctor. If I'm honest, like, yeah. Yeah, like here I feel a bit like something is.
Yeah. There's still a tendency probably for that to go that way.
Right.
But by doing this exercise where you involve your whole body, lifting that arch and rotating the leg outward.
This, yes, doctor. And surprisingly, I do this like without anyone told me before, like about 2
You were doing it automatically?
Like if I just tighten my glute, right glute.
And rotate it?
Yeah, like I don't need to rotate that, but if I
Yeah.
just tighten my glute, like
Yep.
automatically, like
Beautiful.
yeah.
Excellent.
So just have to tighten my right glute, and then like I try and walk like this.
Uh-huh.
Yeah, and then when I walk like this, like I feel more stable,
Nice.
even.
Very good.
Yeah, yeah. But I just have to tighten my right glute. But it's unnatural for me if I.
Yeah, we want that to be automatic.
Yes, yes.
We
like
want that
just
to be an
natural-
automatic
yeah,
thing,
yeah.
not something that you have to consciously do. Okay?
Could I walk?
Yeah, go ahead. Yeah. And my client is a football player. His goal is to play professional, and that's actually what we call soccer. He kicks a round ball, right?
Yes. Sir.
So you certainly have a good sense of body awareness.
Oh,
Okay?
yes. With myself, yes.
Yeah, yeah.
Myself for sure.
Yeah,
Yeah.
yeah. Any other comments?
No, not really. Okay.
Good. Okay, so we'll stop filming. Wonderful case study. I'm
Thank you.
quite sure it's the only one on YouTube, and
Right.
hopefully the other people will be helped with this video.
Oh, thank you, doctor, for helping me.
Yep.